For the survey's 2015 beta test, all issuers of QHP products, whether in a federally facilitated exchange or a state-based exchange, will be required to conduct the survey. Sampling will be determined by state at the product level. The requirement will apply to those products with a minimum of 500 enrollees as of July 1, 2014. Those with less than 500 enrollees will not be required to administer the survey. Today we're going to take a few minutes and talk through the new quality rating system, as well as the new QHP survey requirements. And we'll wrap up by looking at some timelines and some dates that plans need to be thinking about. The Myers Group was founded in 1993, really with a vision to serve the healthcare community. We've been conducting the CAP survey since the program's inception in 1998, and are probably best known for our reliable delivery of regulatory surveys. However, over the years, we have continually evolved to meet the growing needs of our clients and the healthcare community. Today, in addition to regulatory surveys, we offer a full line of healthcare solutions, which include our non-regulatory or insight surveys, our call center support services in our TMG Connect division, and performance improvement consultation to help plans improve their scores and overall performance. TMG recently completed vendor training for QHP CAPs in the middle of November, and we wanted to share with you what we know today as a result of that training and our continued monitoring and communication via the CMS website and technical guidance. Please remember that while we have summarized much of the information here, it is the CMS documentation that is the official and final guidance, and we highly encourage plans to visit the project website and review all materials thoroughly. A quick note, we have found that CMS and other entities don't appear to have settled on a consistent name or reference for the new QHP survey. While we generally refer to it as QHP CAPS, we have seen it referred to these other names included here on the slide. Alright, let's talk about the new framework being proposed to measure the quality of plans being offered in the marketplaces. Many of you may be familiar with the Medicare Advantage star rating system. HHS is proposing something similar for the qualified health plans being offered in the marketplaces. Let's talk about a few of the main highlights of the proposed quality rating system. As you might know, the Affordable Care Act requires the development of a system to rate QHPs based on quality and price. One significant part of this mandate requires the development and implementation of a survey to assess the consumer experience. CMS has indicated that reporting for the QRS will be at the product level, so HMO, PPO, for the initial years. There will be two sets of measures, one for adults and families, and another set of measures for child only, though the child only system will be developed later. The goal of the quality rating system is to provide consumers information to use when they select a health plan on the exchange, and also to facilitate regulatory oversight by states, CMS, and accreditation authorities. The most current information is available at the link shown here, including the two documents listed at the blue box at the top of the slide. 2015 will be the beta test year for both the QRS and QHP CAPs. The 2015 beta test will provide feedback to QHP issuers and the marketplaces prior to public reporting during the 2016 open enrollment period for the 2017 coverage year. QRS and QHP survey requirements apply to QHP issuers offering family and/or adult-only health insurance coverage through the marketplaces, regardless of the marketplace model in which they operate. So all marketplaces, be they federally facilitated, state partnership, or state-based marketplaces, all have these requirements. A QHP issuer must meet QRS and QHP enrollment survey requirements for QHPs that have been offered through the marketplace in the previous year. Earlier guidance did not include catastrophic coverage plans, but that has been updated here to include catastrophic plans. QHP issuers must include enrollees from coverage in the individual market offered through a marketplace, as well as individuals from the Small Business Health Options Program, or the SHOP exchanges. After analyzing public comments and task force recommendations, CMS has finalized the measure set for the 2015 QRS beta test year and the intended measure set for the 2016 public reporting year. What you see here is the complete measure set, though for 2015, not all will be collected because some require more than 1 year of data. As part of the proposed QRS measure sets, CMS developed a QRS adult family measure set and a separate child-only QRS measure set. At the present time, however, CMS continues to monitor the number of child-only QHPs in the marketplace. The limited number of child-only QHPs and enrollees may prohibit reliable child-only QRS rating calculations in the early years. Currently, the QRS measure set consists of 43 measures, 12 of which are survey measures that will be collected as part of the QHP enrollee survey, which we'll discuss in more depth shortly. The data sources for these measures will come from clinical quality data and the survey. You'll notice that like the Medicare Advantage STAR program, the QRS is structured in a hierarchical way, with measures classified by various domains and composite areas and rolling up to an overall STAR rating. Here we see the 12 reporting measures, which will come from the QHP CAP survey. 10 of the 12 measures will be scored and reported in 2015. The additional 2 shown here require a 2-year rolling average and will be reported in 2016 and going forward. Here's a quick overview of the other measures that will be reported for the QRS in 2015. Additional details and measure technical specifications are available in the CMS documents. CMS has made every effort to align the QRS measures with other existing quality measures that plans are required to report. We've included this slide to show how all these measures come together to the quality rating system. You'll notice on the top we show the flow of the QRS clinical measure data and how that flows into the IDSS, which is NCQA's interactive data submission system, and then goes to CMS for calculation, and then the enrollee survey data, which is collected by QHP enrollee survey vendors, validated and submitted to CMS for inclusion then in the quality rating system. For purposes of 2015 QRS public reporting, issuers must collect and submit measures for each product type. CMS will calculate all the quality ratings using the 5-point rating scale. QHP issuers must contract with a certified vendor to audit and validate sample frames and data, and then to administer the QHP CAP survey and submit that data. We should also note that CMS has indicated that while the federally facilitated exchanges won't display any results from the 2015 beta test, state-based exchanges may be able to use those results with the appropriate disclaimers that the data is new and preliminary. Now let's take a look at the QHP CAP survey and protocol for 2015 and beyond. The Affordable Care Act required CMS to provide a systematic format for gathering and reporting information about the experience and quality of care received by enrollees in a QHP. As such, CMS, along with industry consultants, have developed a QHP CAPS survey. This survey will serve to help consumers choose among competing health plans, provide actionable information that QHPs can use to improve performance, and to provide a consistent and resourceful measurement tool for the reporting needs of marketplaces and regulatory authorities. For the survey's 2015 beta test, all issuers of QHP products, whether in a federally facilitated or state-based exchange, will be required to conduct the survey. Sampling will be determined by state at the product level. The requirement will apply to those products with a minimum of 500 enrollees as of July 1st, 2014. Those with less than 500 enrollees will not be required to administer the survey. Let's talk a bit about the content of the survey. The most recent version used for the field test in 2014 had a total of 107 questions, but CMS has pared it down to 76 questions for the beta test. The survey is based largely on the CAPS 5.0 Adult Medicaid survey, with additional questions coming from a variety of other sources. There are a total of 7 domain or topic areas, plus a variety of HEDIS, demographic, and rating questions. Several of these areas are common to other CAPS surveys, such as access to care and provider communication. Each of these domains has 3 or more questions with appropriate screener questions. And you can see the blue star is signifying those domains which include key questions which apply to QRS measures. Each of these domain areas contains questions that will be included in the QRS. Consistent with other CAP surveys, this survey includes all of the global rating measures such as rating of health plan, personal doctor, specialist, and healthcare. The survey also asks about the number of visits to the PCP and specialists. The demographic and respondent characteristics in the About You section are a significant portion of the survey. CMS does indicate that scoring will include case mix adjusting to potentially include age, gender, and health status. Factors to be used in the case mix adjustment will be determined based on psychometric testing and additional analyses using the 2015 beta test data. A mixed mode of mail and phone has been decided on for the 2015 beta test. The pre-notification letter will also include instructions for how to complete the survey online, so enrollees will have the option of completing the survey online via mail or on the phone. Let's talk about the sampling. As we mentioned, for the 2015 beta test, sampling units are defined by the state at the product type level. CMS has indicated that once they review the results for the 2015 beta test, they will revisit the need to sample at the meta level for each product going forward. The standard sample size for the survey is 1,000, with a minimum enrollee sample of 500. CMS is targeting 300 completes, or a 30% response rate. Member eligibility criteria include adult 18 and over with a minimum of 6 months continuous experience with no more than one 30-day break in enrollment. CMS will be providing templates of the survey in English, Chinese, and Spanish. There will be no oversampling allowed in 2015. Unlike Medicare caps, health plans will be providing the sample to their vendors. CMS requires that sample frames constructed by the QHP are validated by an approved auditor. For the QHP cap sampling frame, the QHP issuer is responsible for sending the validated sampling frame and validator's approval notice to the survey vendor before the survey can be administered. Survey vendors will dedupe the sample by household family unit prior to selecting the 1,000 random enrollees to receive the survey. On the next few slides, we have summarized the timeframes and milestones you will want to be cognizant of as we plan for and enter the 2015 beta test year for the quality rating system and the beta test for the QHP CAP survey. For the clinical data measures, beginning in the fall, CMS is advising that plans begin exploring and contracting with a data validation auditor. Plans will begin data collection and have data validated starting in January through June of 2015. QHPs will submit clinical measure data beginning in June. In the fall of 2015, CMS will be providing QHPs in states with their QHP QRS scores. CMS is advising that plans begin preparing their systems for data collection and submission. Here is a general timeline provided by CMS for the planning, startup, and rollout of the 2015 beta test. Note that plans must contract with an approved survey vendor by January 5th, 2015. Sample frames must be complete by January 31st so that fielding can begin in February and finish by the end of April. QHP CAPS data must be submitted by vendors to CMS by May 31st. While the prior slides provided an overview of timelines and milestones for planning and survey administration for 2015, this slide provides a broader perspective starting with the CMS field test of 2014 and then the future rollout of the survey, and also includes time frames for the first year of public reporting in 2016 and going forward. That completes our summary of the QRS and the QHP CAP survey. There are a lot of details that we were not able to cover here, so we do welcome you to reach out to us with any further questions. Thank you.